Hello, my name is Drew Lekier, and today I'll be analyzing the Community American Medical Association, otherwise known as AMA, in this discussion for Discourse 300 at UMKC. Okay. The American Medical Association, AMA, was founded on May 7th, 1847 by Dr. Nathan Smith Davis. Since its foundation, AMA has built upon the core values of developing medical practices to best ensure health equity amongst the different racially or socioeconomically diverse aspects of our population. The AMA is composed of physicians, residents, and medical students all across the United States, all with the shared goal of working with the community and its health concerns to help patients live at their best. The goal of providing the most comprehensive and most equitable health care for our patients is what unites doctors and students across the nation from over 32 different medical programs into one cohesive group. Within this discussion, I'll give a brief summary as to why I'm interested in this group. I will also address a little bit about the history of AMA and what the current mission statement is addressing, and I will then discuss the patterns of sameness and typical language practices that further unite the group as a common cause, and finally I will conclude this discussion by emphasizing the importance of providing healthcare equity. First off, I became interested in the AMA when I first joined the UMKC School of Medicine. They explained that the community was built to provide healthcare professionals with a credible and reliable set of colleagues and like-minded individuals. I first joined in 2014, 2015, my first year in medical school, either way. They described being able to tackle systemic goals, i.e. healthcare disparities, through legislative efforts, as well as research and institutional changes. I was interested in joining this group because it seemed like a good way to get exposed to mentors and other members of the healthcare community. One of the benefits of being in the AMA is being that you're always on the forefront of research, discussion, effective changes. And that as a practitioner, you have a network of allies all over the country that are dedicated to providing the best care possible. There's a quote by the American Medical Association CEO, Dr. James Muldera, that puts it best. Quote, "If your mission, it's your mission to help people live their best lives. It's what physicians do," end quote. And I know it's really simple, but it really does seem to encapsulate, a lot about what I'm going to talk about and kind of what American Medical Association is about. So I thought it was worth throwing in. Anyway. As previously mentioned, the American Medical Association was founded in the middle of the 19th century by Dr. Nathan Smith Davis. Since its founding, the American Medical Association has been dedicated to developing research and techniques into bettering the practice of medicine and the bettering of the lives of our patients. They tackled the issue of public health through vaccination efforts, research, and sanitation. American Medical Association has been at the forefront of medical research into recently discovered diseases and treatment options. And today, the AMA is working towards limiting differences in healthcare for people of different socioeconomic classes or groups. They advocate for healthcare being a right for everyone is entitled to in an attempt to pass legislation that promotes universal healthcare and mitigates disparities due to race or other social determinants, ensuring access to meaningful and affordable healthcare for all patients. So now I've talked a little bit about what AMA is all about. Now I'm going to define some of the language, practices, and patterns of sameness that lend themselves to our cohesiveness as a community within AMA. It may seem obvious, but a large distinction in the language usage by members of our community is through the usage of medical terminology. That is to say, the language in which each and every one of us have been taught about specific terms and just the way we were taught medicine to begin with. At some point, each member of American Medical Association was taught these terms that have been adapted to communicate complex medical conditions and situations. This, coupled with the tendency to speak in acronyms and mnemonics, can be seemingly ostracizing for those that are not familiar with their usage, i.e. a patient or a layperson. But to those of us that speak the language, it is just yet another way that we are able to better coordinate our interactions in a meaningful way, further enhancing our sense of community in this way. So in this way, we are united by the way we communicate. Furthermore, our sameness is exemplified by the trend that at some point in our medical career, you will be wearing or have worn a white coat and stethoscope. These two things can be closely associated with the term doctor. Most of the time in practice, members of AMA share an affiliation for these articles of clothing or tools of the trade. But all in all, All of these things are each in a small part kind of what it is to be a part of this community. The central theme tying us all together being our desire to provide the best healthcare for all of our patients. Okay, so finally I mentioned the healthcare disparities that are a large target of AMA's legislative efforts in an effort to enhance health equity. These disparities are largely determined by social determinants of health. Social determinants of health are the structural determinants and conditions by which people are born, grow, live, work, and age. These can include socioeconomic status, education, and access to healthcare, just to name a few. These are the aspects of our society that play the biggest role in health outcomes in our nation. These things have been found to greatly impact the meaningfulness and efficacy of the healthcare efforts in our nation. I have a quote by Dr. Susan Skocilek, forgive me on the pronunciation, AMA's Vice President of Medical Education. She says, quote, "Only about 20% of our health overall is affected by a healthcare system, and the biggest components come from the social determinants of health," end of quote. So by enhancing the diversity of our healthcare workforce, teaching and promoting equity in funding and care distribution, we, American Medical Association, can begin implementing systemic change to break down these barriers to equal health overall. Okay, so in conclusion, the American Medical Association is a community dedicated to establishment of equal healthcare opportunities for all Americans and to developing the best doctor-patient experiences. It is composed of physicians, residents, and medical students who have united under the goal of providing the best medical care for patients. It is a community that disdains to acknowledge stigmatization and instead it truly embraces diversity for the benefits that it represents. Since its foundation more than 150 years ago, it has remained a consortium of individuals that are dedicated to improving the nation's health. Thank you.